This is Agriculture Today, and I'm Shelby Varner with the K-State Radio Network. Today's show begins with Zaira Ruiz, Kansas 4-H Regional Specialist and faculty at the Southwest Research and Extension Center in Garden City, as she explains how social determinants impact health. She lists the various social factors. Zaira continues the show discussing examples of social determinants in Kansas and Superfund sites. Pottawatomie County Extension Agent Shannon Blocker ends the show sharing ways to improve soil to boost resilience, create a thriving landscape, and provide long-term soil vitality. That and more is coming up ahead. You're tuned in to Agriculture Today, and we start our show discussing social determinants for health with Kansas 4-H Regional Specialist and faculty at the Southwest Research and Extension Center in Garden City, Zaira Ruiz. Zaira, thanks for joining us today.
Yeah, thank you so much for having me, Shelby.
Zaira, what are social determinants?
Yeah, so the social determinants of health are the everyday conditions that affect how healthy we are. So things like income, education, housing, food access, and community connections. And according to the U.S. Department of Health and Human Services, the 5 core social determinants of health are economic stability, education access, healthcare access, neighborhood and environment, and social and community connections.
What are a few different examples of each of those 5 categories?
One very important social determinant is the economic stability. What is your socioeconomic background? So how much money do you make? What's your income? Do you have a high income, low income? And based on that income, what are your opportunities? Do you have a lot of opportunities for growth, a lot of opportunities for work? Or are you pretty much locked into a lower income job? There's not a lot of room for growth in your job? And these aspects matter greatly in your overall health and longevity. So, for example, stress from finances, stress from working long hours at work, stress from dealing with difficult people, or having a very difficult job that makes that affects your economic stability. Those social factors are directly influencing your physical and mental health.
Are there other determinants also?
Yes. So educational access. Where did you go to school? Who did you go to school with? And although it might not seem very important, the schools that are available to you, even if you live in a big city and there's many schools, attendance to certain schools is determined by your neighborhood or your zip code. So think about educational access. Where do you live and what kind of schools are available to you in your neighborhood or in your city or even your state? Sometimes, even though our parents or you as a parent might really want to give you the best educational opportunity available, there might not be very many educational opportunities available, very good ones, or that are accessible to you. Or maybe there is a really good educational opportunity, for example, a very good school. This is an ideal school, the best school in the state, but it is 2 hours away from you. What is the probability that your child can attend this school? So again, where you live determines what schools you go to, who you meet at that school, your life partner potentially, high school sweethearts, for example. All of those opportunities or decisions that are made in a very, very early stage. Think back to even elementary. What kind of teachers are available to you? What kind of funding? What kind of opportunities are available to you? Did you go to a school with great teachers who get paid very well, who have the opportunity to provide amazing learning experiences, for example, field trips or extracurricular activities? Did your school have sports? Did your school have a gym? These are all factors that may not appear to have that much of an influence on your overall longevity, but piled up, they make a huge difference. Healthcare access, for example. What hospitals are nearby? Do you have to travel very far to get to a good doctor? Where's your specialist located? Do you have to take time off of work to go see your specialist across the state in Kansas City? Or do you have them 20 minutes away where you could just get off of work a little earlier and make it to your appointment? Again, healthcare access. Also, what kind of insurance do you have? And again, if you start noticing all of these social determinants start piling up and adding up, and so what kind of insurance do you have? Does it cover your specific health issues? And maybe where you get that insurance is your job. So again, having a good job would make a big difference here. So you could see how from a very early age, all these social factors or social determinants can stack upon each other to either put you on a path for success and a great healthy life or a not so healthy life and a shorter life. Neighborhood and environment. Can you go outside and walk at 8 p.m. at night? Is there enough lamppost? Is it safe? Is there broken glass everywhere? Are you constantly stressed that somebody's going to break into your house? Do you have to lock all your windows and doors and cars because there's a lot of theft? Those things have a huge influence on, again, stress. Or do you live in a very peaceful neighborhood where there's a lot of opportunities to talk to your neighbors and have cookouts and parties and have your kids grow up together and you live more stress free and it's affordable. That's again a huge factor in stress levels for many people. And lastly, social and community connections, which again, all of these social determinants add up and stack up. But the social and community factors, a Harvard happiness study, which it's been coined that way, but determined that one of the most important factors in longevity and health is not your genetic code, but your relationships and your connections and the depth of those relationships and connections. And the main relationship that affects your overall all health and happiness is your life partner that you choose. And then after that, your immediate family, and then your extended family and friends. So that has been very eye-opening because it really goes to show the importance of social and community connections, not only for fun that we think, oh yeah, it'd be really nice to have more. No, for your overall health and longevity. And according to the longest study on adult development, which is the study I mentioned, the Harvard happiness study, the key to happiness is your relationships. So I hope that that gives a better picture of how important the social determinants are to our overall health and wellness.
And when we're thinking about the health and wellness of a person, not discounting completely genetics and care.
Yes.
However, when you do look at this data, how much of a person's health is determined by genetics and care?
So actually, research shows that up to 80% of health outcomes are shaped by non-medical factors. In other words, your health and how long you live is more dependent on your zip code than your genetic code. And this is according to the American Heart Association of the Midwest region. And this is a direct quote from the World Health Organization. Research shows that the social determinants can be more important than healthcare or our genes in influencing health. And that is a direct quote from the World Health Organization. So to answer your question more concisely, 80% of our health comes from the social determinants of health.
You've mentioned research for the Harvard Happiness Study and from the World Health Organization, but has there also been research when it comes to loneliness?
Yes, actually, this is very sad and very unfortunate, but we are currently in our epidemic of loneliness and isolation, and the U.S. Surgeon General Advisory on the Healing Effects of Social Connections and Community from 2023 stated that loneliness is far more than just a bad feeling. It harms both individual and societal health. So it is a truly epidemic of loneliness, and it is associated with a greater risk of cardiovascular disease, dementia, stroke, depression, and anxiety, and premature death. So when we talk about the importance of connection, this isn't like a plus or a good to have. It is a necessity. It is foundational. And these are again, this is a direct quote from the U.S. Surgeon General's advisory. And This to me was a very interesting comparison or I guess illustration. So the mortality impact of being socially disconnected is similar to that caused by smoking up to 15 cigarettes a day and even greater than associated with obesity and physical inactivity. And this is according to the U.S. Department of Health and Human Services. So I don't know about you, Shelby, but for me, before I became, I guess, more knowledgeable about this, I would have never thought that social connections mattered so much.
It is very interesting. And another point when we were prepping for this interview, talked about food deserts and food swamps. And how do you see that factor into the health or the longevity of a person's life?
Yeah, of course. So a food desert is a place that has lack of access to healthy food. And if you think about visually a food desert, you're looking down a street and everywhere you look, it's just empty. It's literally a desert. Or there is some food, but it's usually fast food or gas station food. And according to the U.S. Department of Health and Human Services, a food desert is defined by a place that requires more than 1 mile if you're in urban areas, or 10 miles if you're in a rural area, to the nearest supermarket or large grocery store. So think about it like this. If you live in a rural area and the closest grocery or supermarket is 10 miles away from you, you live in a food desert. And if you live in a city, then if you live farther than 1 mile away from a supermarket or grocery store, then you are also in a food desert. So again, this affects Americans all across the United States, not just in rural areas.
That was Kansas State University's Zaira Ruiz. We're cutting to a short break now on Agriculture Today, but when we come back, we'll once again be joined by Zaira as we continue our conversation of social determinants for health. You're tuned back into Agriculture Today, and we continue our show with the conversation on social determinants for health with Kansas 4-H Regional Specialist and faculty at Southwest Research and Extension Center in Garden City, Zaira Ruiz. And Zaira, as we're talking about these social determinants, wanting to focus in on a city just here in Kansas, Wichita, Kansas, and how do you see some changes for the longevity of people living in West Wichita to maybe a neighbor of Wichita?
It came to my attention via a video from the American Heart Association. So if you look at a map of Wichita, and Goddard is about 8 miles from a neighborhood in West Wichita. And Goddard has an expected, life expectancy of about 86 years a person. And neighborhoods in West Wichita have about 67 years of life expectancy at birth, by the way. So you're talking about a discrepancy about 20 years of longevity. So to put it simply, if you live in Goddard and your life expectancy at birth is about 86 years, and you take a look at a neighborhood in West Wichita that has a life expectancy about 67 years. That's a discrepancy of about 20 years. Like, that is very significant. And they are 8 miles away from each other. So then what is going on? Why is it that somebody living 8 miles away from you could be expected to live 20 years more than you simply for living in a different neighborhood? And the main points here are there's a lack of access to nutritional foods in West Wichita and in that area, in that neighborhood. There's a lack of access to physical activity opportunities. There's no YMCA or at the time of this, when this data was collected. And there's more limited opportunities overall because of the socioeconomic status of individuals living in that area. To give you an example, the median household income in Goddard is around $92,000, and about 1 in every 100 residents is living below the poverty level. So that's a very good neighborhood. If 1 in 100 residents is living below the poverty level, in comparison to the area in West Wichita, where 1 in 3 residents is living below the poverty level. So again, this kind of helps give more context to that 20-year health discrepancy.
When we're thinking about longevity, are we thinking about saying that 86 years? Is it for people who were born in Goddard, people who spent most of their life in Goddard, or can that change depending on moving about the state or the country or the world?
Absolutely. So again, this is kind of based if you were born and stayed in that neighborhood. If you are aware of the social determinants of health and how they influence your life, then you could be more cognizant and try to work around those, factors. So for example, just because you were born in West Wichita does not mean you're sentenced to a shorter life expectancy, for example, but that does mean that you have to be aware that your opportunities might be very limited, or more limited than those living, for example, in Goddard. So what does that mean? You probably have to be more aware of where's your nearest grocery store? Where are you getting your groceries from? What are you eating? Is the closest thing to you because you're in a food desert, for example, the gas station food, versus in Goddard, if you go down the street and there's a farmer's market and you have access to healthier, fresher food, even something as simple as getting some healthy exercise after dinner. If you live in West Wichita, do you feel safe enough to go out after dinner and take a walk? Is there enough light? Do you feel safe? Or versus in Goddard where you can go run at night and have a healthier lifestyle because there's a YMCA right around the corner. So some of those factors come into play. Again, this is an estimate or again, expectancy, but I believe in that there is agency. And if you're aware of how the social determinants of health affect your life and how your environment affects your health, then we can do a better job at trying to work around these determinants.
And when to take the time to mention one more factor that plays into potential life expectancy and health for people, Superfund sites. And what is a Superfund site? And there's a D. It's not Superfund, Superfund.
Yes, not to be confused with Superfund sites. Superfund sites is a place contaminated by hazardous waste where the federal government is responsible for cleaning it up to protect public health and environment. So why does it matter if you live close to a Superfund site or not? If you live close to a Superfund site, you're more likely to be affected and have a shorter life expectancy or have greater health complications because again, these are contaminated, hazardous waste was either mismanaged or dumped in these areas, and it definitely can have an effect on people for decades to come.
And we've talked about Wichita. However, a case study was also done in Iola, Kansas. And can you tell us a little bit about that study?
Yeah, for sure. So there's a case study in Iola, Kansas, associated with the Superfund site. And in summary, so for anybody who are not aware, Iola, Kansas is located about 100 miles south of Kansas City. And it's a small town of population around 5,000 residents. And I would say about close to a quarter live in poverty. An Iola Superfund site encompasses the entire town. So this isn't a case of, well, you live in this area or this neighborhood. With such a small town, this Superfund site is actually encompassing the entire town. So the investigations of contamination began in the 90s, and then the EPA added the site to the national priorities list in 2003. And although the EPA has conducted emergency cleanups of about 400 properties, there's still quite a few that need to be addressed. And this was as of 2020. But what happened is that when the EPA got involved and realized that there was high levels of lead poisoning, tests from 2011 and 2012 found that approximately 14% of the children tested had elevated blood lead levels. And again, just for context, according to the CDC, there is no safe blood lead level for children. And the effects may not be immediately noticeable, but even low lead levels in the blood are associated with developmental delays, difficulty learning, behavioral issues, and an assortment of other health complications. So the effects can be permanent and disabling. And again, this is according to the CDC. And Yeah, so as a result of exposure to lead and other toxic chemicals, exposed residents are suffering some substantial, irreversible, and life-altering health implications, ranging from neurological and biological damages, and cancer. So, not to sound super scary, but there's Superfund sites all over the United States and all over Kansas as well. If you are interested to know if you live near a Superfund site, the EPA does have a website and we'll include it in the show notes. And so you could input your zip code or your town and explore and see if you live near a Superfund site as well.
If people want to find out more information about social determinants or how their zip code could be impacting them, what's your recommendation for finding some answers or more information?
So if you want to know more about the social determinants of health, I recommend you visit the World Health Organization, and I'll include a few links for you in the show notes. But luckily for us, the United States has also been really proactive about making social determinants of health a more priority. And actually the Department of Health and Human Services, the Office of Disease and Prevention and Health Promotion, has this awesome guide on the social determinants of health, and they have a really cool interactive website that can help you explore more about the social determinants of health and how they impact you and your longevity.
Zaira, I appreciate you taking the time to join us today.
Thank you so much, Shelby. I really appreciate it.
That was Kansas 4-H Regional Specialist and Faculty at Southwest Research and Extension Center in Garden City, Zaira Ruiz. In today's show notes on agtoday.net, I will link resources that she shared with me if you would like to read more on this topic. Before we cut to a break, we're now going to be joined by USDA's Rod Bain and USDA meteorologist Brad Rippey as they share details of a couple of top weather events that took place in the United States in 2025.
What were some of the top weather stories of 2025? USDA meteorologist Brad Rippey says the timing of late summer, early fall drought intensification in the central and eastern U.S. did impact both late developing summer crops and pastures, yet effects to maturing corn and soybeans were minimal.
We are looking at record yields for 2025 for both U.S. corn and U.S. soybeans.
Also included in the list of top weather stories of the year, the remnants of a Pacific typhoon that impacted southwestern Alaska.
The remnants of Typhoon Halong hit southwestern Alaska on October 11th and 12th. More than 1,500 people were displaced. That also resulted in historic flooding in the Yukon. In all, 52 communities were reportedly affected. More than 200 homes were destroyed and hundreds more were damaged.
I'm Rod Bain reporting for the U.S. Department of Agriculture in Washington, D.C.
We're cutting to a short break, but we'll be right back.
Welcome back to Agriculture Today. Along with Shelby Varner, I'm Jeff Wickman. Simple science-based practices can transform the way your lawn and garden grow. For January's K-State Garden Hour, Pottawatomie County Extension Agent Shannon Blocker explored soil health through the powerful combination of physical, chemical, and biological functions that can help boost resilience, create a thriving landscape, and provide for long-term soil vitality.
Soil health is really the combination of those physical, biological, and the chemical aspects of soil. So the best management practices are ways that we should try to limit or reduce compaction, how we can minimize tillage, how we want to try to keep the soil in place, how we can add organic matter and make it a change to some of those soil physical properties, and why we would need to maintain a more natural soil profile. In our efforts to limit or reduce compaction, we really shouldn't work wet soils. We really don't want to go out there and do any tillage, try to plant things. When soils are really wet, we would like to stay off of them because traffic and even our garden tools that we're using will have negative impacts in regards to compaction. Reducing or minimizing tillage. One of the key things that I think about is that some people will actually choose to use their rototiller possibly weekly or extremely regularly as a method of weed control. And I would say that from a soil health standpoint, that is not a best practice. Trying to develop a situation where you only are going to till or work with your largest body of your soil once a year, or even possibly less, is actually a great idea. If you're going to have to lower your pH and you want to incorporate sulfur, do that when you're already going to be doing compost, fertilizer, and things like that. Soil health also is helped by conserving soil. Choosing a location that doesn't have a lot of slope can be really a help in your garden practices. Organic matter is almost always a great idea. You've probably heard always, and it is, but there are a few caveats that I really want to mention in regards to adding organic matter in regards to soil health. And the advantages are that aggregate stability, the infiltration, and the water holding capacity. A sandier soil doesn't have a great ability to hold on to water, but if we add organic material to that, water can be held by that organic material much more effectively. And so we can make some positive changes by doing those kinds of things. One of the challenges that we run across at times is that we hear that organic matter is what we want to always do, and it's the solution. I would say that in many ways it is, but our source of organic matter can become an issue for us. And maintaining a natural soil profile. Basically, we don't want to try to change our soil texture by adding sand. In many cases, that would result in something resembling concrete. So don't do that. And then one of the things that I think is really important for gardening is to create that gentle transition between an improved soil. So maybe you're doing a raised bed where you have improved that soil, but you wanted to make a gentle transition because water in particular is very sensitive to change. It doesn't really like it. And so a gentle transition and allowing that to occur by adding some compost to the existing soil, mixing it together, and then adding your improved soil and mixing that a little bit, and then going with your improved soil on top. Those kinds of situations when building beds are in our best interest to help with infiltration and some of those natural soil profile factors.
That's Pottawatomie County Extension Agent Shannon Blocker with information on how to improve soil health. To listen to the full webinar, search for K-State Garden Hour and click on Most Recent Webinars. And that'll do it for this edition of Agriculture Today. For Shelby Varner, I'm Jeff Wickman. This is the K-State Radio Network.